Whenever you're ready.
Good morning. Today being Monday, November 20th. This is the Public Health Committee, and I am Cheryl Strathman, the chair. And I'd like to call this meeting to order and call attendance, please.
Juby here. Silva. Tarver.
Here.
Oh, Silva. Yes.
Here. We hear you, Dr. Silva. Thank you.
And Tarver, I got you.
Tarver's here remotely. Thank you.
Williams. Young.
Young here.
Sanchez.
Sanchez present.
And Strathman.
Strathman here. Okay, Mr. Tarver has requested remote attendance this morning due to work. Do I have consent to let him be here in that regard? Okay, thank you. I'd like to have a motion for approval of the minutes from October 18th, 2023. Have a motion in a second.
Sanchez moves for unanimous consent to approve.
Thank you for the unanimous consent. All in favor, say
Aye.
aye. Okay, I forgot to say that on this date today, in 1863, it is the anniversary of the Gettysburg Address. That was yesterday? Oh. He is right. You know, he's all right.
There was a leap year in there, so.
Yeah, that must be it. That must be it. Oh, you remember.
Oh,
But you
boy.
know, I think today was the day that the Chicago Tribune wrote an editorial saying that Lincoln gave the most ridiculous speech that they had ever heard.
Well, that's interesting. Yeah. Okay.
Wow.
Okay, and do we have any requests for public speaking on agenda this morning? On agenda? Okay, did you get the request from the? Yes. Oh, we don't have any. Did you get the paper from me?
Oh, yeah.
Okay, let me go. Would you go get it? That's interesting about the Tribune making that response when it's been thought of as one of the most memorable speeches by an American president ever, and was only 275 words. So I
The
think,
fellow that spoke before him, Everett, who had spoken for 3.5 hours, said to Lincoln afterwards that you came closer to the meaning of the battle in 2.5 minutes than I did in 3.5 hours.
wow. And that is going to be our agenda for the meeting this morning, right? No 3.5 hour meeting. Okay, so we have on agenda Dr. Sherry Bresnahan. There should be a button down at the bottom. Yes. Did you get it?
I did.
Now you need to put the mic up to your mouth, please.
If one changes laws without changing hearts, the changed laws will be changed back by the unchanged hearts. Let's look at a past mandate. The CDC's own vaccine injury reporting system, VAERS, showed 4,070% increase in miscarriages and stillbirths last year. Remembering that at the very most, only 10% of injuries are ever reported to VAERS. The CDC, FDA, and other federal government agencies are still pushing these safe and effective jabs. There were 20,538 infant fatalities in 2022 in the US, not counting the 80-20 abortions just in Illinois. That's a 3% increase from 19,928 deaths from 2021 to 2022. Half, 50% of the SIDS cases occur within 48 hours after a vaccine, commonly DTP, was administered. 7 in 10, 70%, happened within a week of a vaccine. This relationship has been known for decades, but as we've seen with COVID, inconvenient truths are censored for profit, and the general public's knowledge is limited. Blue Cross Blue Shield pays your doctor a $40,000 bonus for fully vaccinating 100 patients under the age of 2. If your doctor manages to fully vaccinate 200 patients, that bonus jumps to $80,000. Pediatricians lose the whole bonus unless at least 63% of patients are fully vaccinated, and that includes the flu vaccine. It's not just the $400 for your child's head. It could be the whole bonus. The secret South African purchase agreement from Pfizer states, unknown efficacy, unknown adverse effects, unknown long-term effects. According to newly released documents, they did know a number of these unknowns. Due to strict mandates and heavy government pressure, the 94.7% of New Zealand's population 12 and up are fully vaccinated. New Zealand has suffered a 3,000% spike in excess deaths over the past 2 years. In a 49-week period in 2022, there were 5,285 excess deaths, a 3,203% increase over the 2020 figures. Italy, another heavily mandated country, has achieved a 0 birth status in 3 months due to the fact that for every 7 births, there were more than 12 infant deaths. The population has dropped by 179,000. Australia, 12% more people died than expected in 2022. At least 104,000 more Americans died than expected. 52,427 excess deaths were reported in the UK, 81,028 Germany, 17,731 in France, 10,418 in the Netherlands, and 2,640 in Ireland. Insurers saw death benefits rise 15.4%. In 2020, biggest one-year increase since the 1918 Spanish flu epidemic, followed by a record $100.28 billion in total death benefits paid out in 2021. The rates haven't greatly diminished as COVID infection rates have declined. Mortality rates are alarmingly rising for different categories, including younger adult mortality rates that are up by more than 20% above historic norms. In 2023, death rates for Americans aged 15 to 45 rose 20 to 24% above normal in 2020 and soared in 2021 to a level 30% increase for 15-year-olds and more than 45% increase for 45-year-olds. Sorry. Pascal Najaji, the son of the World Economic Forum co-founder, is demanding justice, calling for criminal charges against entities like the WEF, WHO, Gavi, Pfizer, Bill Gates, and more for the bioweapons they have developed, released, and pushed across the globe. This is just one mandate. There are many mandates, and they're all combined. Consider the mandates you put forth or are even considering putting forth. There are large ramifications. Thank you.
Thank you. Next, we have Ms. Jean Meyer.
Good morning. Jean Meyer, concerned resident, Christ follower, patriot. I want to protect the liberty given to us in this constitutional republic. I'm also a master's prepared nurse. I support the proclamation expressing support for Kane County health freedom. Ben Franklin, one of our founding fathers, stated those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. It was the intent of our founding fathers of this United States to have a limited federal government. Hence, the colonies refused to join the Union until the 10 amendments, which limited the federal government, was in place. The 10th Amendment of our United States Constitution states, the powers not delegated to the United States by the Constitution nor prohibited by it to the states are reserved to the states and the people respectively. Note, the proclamation supporting health freedom in Kane County, which is on the agenda today, states that any measures instituted by Kane County to prevent harm to public health must comply fully with federal and state laws and constitutional rights of the individuals. God's word tells me humanity is capable of unimaginable evil. World history tells me men are always conspiring to overthrow governments. The COVID pandemic and the unconstitutional mandates with governments at all levels acting like a well-oiled machine to use terror and misinformation to subdue and partially destroy our people and our country. It was just that plan to destroy the liberty that makes our country a coveted place to live around the world. I am asking you board members to be courageous, to throw off the Republican, Democrat lines and put our country first. Support the proclamation, support liberty, stand against Marxism, to not protest the loss of our Constitution and the liberty and bounty it has provided implies informed consent. If we don't protest, that is implying consent. That's a little scary. It's a responsibility. When the next generation inherits this country, if this country is allowed to follow the path we're on, if they ask me why I did nothing to save it, I can with pride say and tell them I tried. I spoke out again and again. What will you be able to say to the next generation? Hopefully not, I went along with it. I have asked for prayer for you guys, and I've come to like you guys over the last few months. I like some of the heated discussions you can get in. That's wonderful. But I've asked for prayer from friends that just one of these board members, and of course more would be great, will defect from the ranks and support that proclamation. Be courageous, support the proclamation, expressly support for Kane County health freedom. Thank you so much.
Thank you. Okay, and the monthly financial reports are on file. Anybody has any questions about them?
Madam Chair, Rick Williams here.
Yes,
I
Mr. Williams?
I apologize. I was having trouble with my audio, so I couldn't say anything. I couldn't hear anything, but I have a request to be remote for work reasons. I don't know if that was discussed and granted or not.
Okay, this is Mr. Williams requesting remote attendance. Is that okay with everybody? Okay, thank you, Mr. Williams.
Madam Chair, if you may indulge me in one last request, I have to leave at 11:45, so I was hoping maybe we could take go a little bit out of order so I could vote on the resolution and the proclamation before I have to jump off.
I'm sorry, I'm having trouble hearing you.
We could move up.
I have to leave the meeting at 11:45. I was hoping we could go on some of the items when we get to the executive director and anything that requires a vote. I was hoping we could maybe move that up and then do the health update and strategic plan after we vote on the 3 items. So I'm going to have to leave at 11:45.
Okay, I'm still not quite sure you're
He
asking.
wants the 3 resolutions voted on before 11:45.
Okay, let everybody tell me.
He wants to move the vote.
Okay, now I understand you. Thank you. Do we have any objections to me moving that? Okay. So we'll do that. First, we will do animal control, and then we will do the health proclamation and the reports from the health department. So, good morning.
Good morning, everyone. I have an update on both the heater. We are fully functional with heat in the shelter again.
Yay.
We're good to go. And the generator bids have come in. The Building Management Department has selected a group, so I will bring forward the resolution at your request to put it through for next month. So I will have those for you. Real quick on my statistics. I just wanted to point out a couple things so that people knew what was going on, because I like you to be informed. If we look at the top line, the number of tags purchased and stare at the fiscal year 2023 compared to fiscal year 2022, you're going to notice the large number compared to last year. This does not mean that more people are buying tags. What this means is my computer system update is working. So we are automatically inputting these tags now. There was a fee for this program. It was something we decided to do during COVID, and it's actually finally working. So we're getting more real-time data. So that's why that number is so much higher, because we're normally months behind, and this had to be hand entered by every person at the shelter. So it was just delayed. So we're just excited to have that done. Then the other one, Blair, if you can scroll down to the bottom, please. Euthanasia numbers. You will notice that this last month, we had a very large cat euthanasia number. This is due to a case without giving any details because it's currently under ASA review. This was a hoarding case that we have dealt with, and we brought over 101 cats out of that house. I'm not allowed to give more details, but I just want you guys to know why the number was what it is so that you understand the justification behind that number. If anybody has questions about it, I'd be more than happy to talk offline, as we cannot do that because it's a pending case. Perfect. The other thing I have this month for you is our presentation for our yearly vaccine clinic review. I believe it's your second tab. It's the tab for 2023 vaccine clinic. Ah, there we go.
Here we go.
Beautiful. Michael, can I borrow the button? I'm sorry. Sorry. Oh, never mind then. I was just kidding. Sure. So I'm just excited. We finished our 6 clinics we do a year. Again, it starts in April. We take July off and it continues through October. Very successful. I know I gave some data last month, but it's great to finally see it all laid out. And I put the whole list across so we get to see all the years we've done this. This is the 9th year that I brought the clinic back to Kane County. It is a state law that there must be a minimum of 1 rabies vaccine clinic per year offered by the animal control, either centrally located in the county or at your facility. Thankfully, our facility meets both those requirements, so it's fantastic. We continued with the drive-through ability. Thank you. We continued with the drive-through this year where people didn't have to get out of their car. Maybe not. How do you turn it on? Oh, okay. Minor details. Let's try that. There we go. So we continued with the 2023 drive-through clinic. This has just been great from multiple standpoints. And I've actually started to talk to more people that come to the clinic every year and how much they appreciate this versus when they had to get out of their car, walk to the check-in station, then sit outside with their dog. We have had no animals lost. We've had no dog fights between families. It's just been a lot more peaceful. It's kept the animals contained and it's actually made it a lot faster to move people through in itself.
Is that an actual photo from the?
I really do. That photo, it is a repeat from last year, but when it's a classic, you kind of got to repeat it. Again, we've held a total of 48 clinics since I brought these back to us hosting them. Prior to me, they contracted with an outside company that did it all, and it wasn't tracked, it wasn't controlled. We brought the control back to the county, which is where it should be. As you see, our animals impacted every single year continues to go up, and my favorite is the lime greenish, sorry, partially colorblind, the cat line. That's just great to see that we're getting more and more cats coming in, because the state 3 years ago finally made it mandatory for cats to get rabies vaccines and have to purchase a tag. So we're really making that push throughout the cat community, which is great to see that we hit 132 cats this year, finally breaking 100, which was great. And that dog numbers you see continues to grow as well. We do a large press release with Julie Mann's office. They do an amazing job of advocating for every clinic before it comes up. Facebook, we do a large blast. We have a small fund that we put for advertisement, and we use that little bit to put it out on Facebook to at least hit as many people as possible throughout all of King County. And you'll see that it actually got outside the county a little. because of the way they do their boundaries. So we got some outside the county people increased this year, which was nice to see. Again, it's all about helping impact the animals. We start looking at the dog numbers, again, continue to grow, all fantastic. My biggest focus always is, I miswrote there. It should say 2021, 2022, and 2023. Clearly, I don't know how to count. So, but in the 2022 repeated column, we'll see the seniors are up to 164. This is the group we are aiming for the most inside this county. These are the people we continue to offer those free tags to. Again, we are the only county in Illinois that offers free tags to our seniors. And we know how hard the economy is, so we like to ensure that this is pushed large amongst their group. We have some wonderful people we work with and continue to work with that do those senior services groups that we actually get our flyers to every single year. So the seniors are starting to look forward to it and make sure that message gets out there. Oh, and real quick, the out of county, again, that was 20, which great to see that people are getting their animals vaccinated. Doesn't matter where, as long as it's getting done. And then our kitty cats, just great to see the number of the cats going up. This is huge, especially again, looking at those senior numbers, getting up to 58 was fantastic. The more we can help those people do this at a reduced rate to ensure that your animal is protected. And again, this is a law to make sure it's done correctly. Microchips also continue to grow. Again, we finally broke that 100 number of 101. Carpentersville has requested, we've been in discussions to do a microchip clinic out in Carpentersville. So we're going to partnering with the police department and possibly Public Works and some other people to set up a clinic and do that, because that's so important to help people reunite with your pet, is to have those microchips. So it's something we've been discussing with them and hope to do it soon. Our yearly revenue, again, as much as we put this number out there, continues to grow. We have to remember this money gets put back into the clinic. So this is overtime for all the staff. We also have to pay for a second veterinarian to come in. We also provide water to the people that come to the facility, water to the animals, bottled water, little bowls for the animals to drink. So, I mean, we really give back to the people to ensure that this is a self-sustaining clinic. So that way it doesn't interfere or go away, because that's our biggest fear, is that it has to get lost to something. And we want to ensure it never does. If anybody has any questions, I'm always available.
Yes, Mr. Linder?
There it goes. Inquiry on the senior tags. If a senior goes to the veterinarian, if they have the vaccine, of course, either way, they're paying for the vaccine, but is the veterinarian supposed to pass on that senior discount?
Yes, it should be. Now, what an animal hospital does from a business standpoint, we've been told we cannot control, but it is free through the county. So there are seniors that will then mail. We ask just for a picture of your license. So they'll like scan an image or get it to us. So with a copy, they mail it to us and we mail them back a tag, no problem. And then we store everything into our system so they don't have to keep getting their license to us. We load in that scan, so it's always on their account.
Okay, thank you.
Any other questions? Yes, Dr. Silva?
I am a big fan for a number of reasons. I do feel that you're saving us a lot of money. You're saving the county as a whole a lot of money. And because of the way you run the clinics and the way you run animal control, I think you're able to offer services to folks that it's just nice that they don't have to pay, especially seniors. So it works very well for me. You make me look great when I print out the handouts and then I hand it to somebody, and I'm the best thing. So thank you for that. And your facility is clean. It's well run. You're dedicated to it. So I congratulate you from where we've been in the past and how much money we've had to spend in this department. I'm old enough where I've seen it run differently before, and I think you have done a phenomenal job. So I am a big fan of what you do. And also for the fact that I tend to volunteer. That's what I do to de-stress at other animal shelters. And wow, there's a huge difference. And so we're not forgetting in Kane County how important our staff is, how important our residents are, and we still have a heart to take care of the animals. By far, the best one I've seen. Thank you.
Thank you for those words. Thank you. Any other questions? Okay, then I would like to move on to the resolution. And that is, I need a motion and a second for the resolution of authorizing the salary increase for the administrator of King County Animal Control.
Silva moves.
Sanchez seconds.
Okay, Silva and Sanchez, thank you. Any questions about this? Any discussion? Okay. Please take the roll.
Juby,
Ruby, I.
Silva,
Yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strack.
Yes, motion passes. Okay. Congratulations for all your good work. Thank you. Okay, now we're gonna move the proclamation, item E under section 8 here. The proclamation expressing support for King County Health Freedom ahead of the rest of the items in this category here. And so, Mr. Young, would you like to present your resolution?
Yes, thank you. And thank you for putting this on the agenda. Proclamation expressing support for Kane County Health Freedom, whereas the Kane County Board recognizes the importance of transparency, non-discrimination, informed consent, and access to personalized medical care for Kane County residents. And whereas the Kane County Board acknowledges the constitutional rights of residents as outlined in the United States and Illinois constitutions, including rights to life, liberty, privacy, and medical decision-making. And whereas extraordinary circumstances may require public health measures to prevent harm, provided such measures comply fully with federal and state laws and constitutional rights of individuals. Now, therefore, be it proclaimed that the Kane County Board hereby expresses its support for the following statements. Prohibition on unlawful medical mandates. No federal, state, or local law can compel or coerce any Kane County resident to receive medical treatment, such as medications, devices, procedures, or vaccines in a manner that violates federal or state law. And prohibition on unlawful discrimination. It is unlawful to discriminate against Kane County resident based upon their personal medical decisions and status, except as permitted by applicable federal or state law. And right to informed consent. Kane County residents have the right to voluntary, fully informed consent regarding any medical intervention, free from coercion or interference as outlined in state and federal law. And right to personal care. Kane County residents have the right to access any lawful medical treatments available in consultation with the healthcare provider of their choice, subject to applicable state and federal laws and regulations. And freedom of movement. Any restriction on freedom of movement within Kane County based solely on health and/or vaccine status may only be imposed in accordance with applicable federal and state laws. And right of access to care. All hospitals, doctors' offices, and other medical providers in Kane County should provide necessary and emergent medical care to all Kane County residents and mental health care. All involuntary mental health treatment of Kane County residents shall comply fully with federal and Illinois state laws. And right to medical advocate. Kane County residents should have the right to a medical advocate of their choice when admitted to a hospital, subject to hospital policies and in accordance with the state and federal laws. And limits on quarantine powers. Isolation or quarantine of Kane County residents shall only be permissible when done in accordance with due process of law and applicable federal laws and state laws. Passed by the Kane County Board on December 12th, 2023.
Okay, do we have any comments or questions? Oh,
We need a
we
motion.
had a second, right?
It-
Yeah, we had a motion and a second.
No,
No, no
Motion,
one made a
please.
motion or a second.
Oh,
Williams
beg
will
your
move.
pardon. I'm ahead of myself this month. So could I have a motion and then a second for, and then
Williams
discussion?
moved.
Williams moved.
Pardon me, Williams moved. Do I have a second?
Juby second.
Juby seconds. Thank you. Okay, now we can get to the discussion part of this. Any questions or, yes, Ms. Juby?
Okay.
So I always appreciate when David brings things forward because he makes me have to be better at my job. I have to look things up and I have to ask questions, and I really, truly, truly appreciate that. But there is a but. One of your statements in here says in a manner that violates federal or state law. And everything that you proposed is already protected under federal and state laws. So on unlawful discrimination is protected under the Human Rights Act, and it's also protected under the Healthcare Right of Consciousness Act. Informed consent is covered under federal regulations through the Code of Federal Regulations and also the Illinois Doctrine of Informed Consent and the Department of Public Health. The right to personalized care is covered under the Medical Patients' Rights Act. Freedom of movement is covered under the Department of Public Health and also under the supreme executive power given to the governor by the state of Illinois Constitution. Right of access to care is under the Medical Patient Rights Act. Mental health care is under the Mental Health and Developmental Disabilities Code 405. The right to having a medical advocate is covered under the Medical Patient Rights Act. And limit on quarantine powers is covered under the Department of Public Health Act. So because these are already covered under acts, I think that this is redundant because it's already in case law. So if there was something else maybe that you were trying to introduce that wasn't covered in this, I don't know. I'm just went page by page. So because I believe it's already covered, I can't support it. I'm sorry. But I seconded it.
Okay, thank you, Ms. Juby. Mr. Tarver, you have your hand up.
Yes, thank you, Madam Chair, and thank you, Ms. Juby, for those comments. As always, you do a really good job keeping us all informed. This is probably more of a personal statement, but I just like to share, I feel the Kane County Health Department, which includes all their directors and staff, have done an amazing job protecting all of the citizens of Kane County and during some most challenging times. The department works collaboratively with all agencies, locally, state, and federally to ensure they have the most updated information. I feel that this proclamation is an attempt to undermine that ability to protect our residents who have entrusted us. As a health professional myself working with youth and families in underprivileged communities, I believe in the data that's collected and the purpose in which it is used to protect all residents. I do not support this proclamation, and I ask my fellow colleagues to do the same.
Thank you, Mr. Tarver. Any other questions or comments?
Madam
Yes.
Chair, Bates, please.
One moment, Ms. Bates. Mr. Young.
Hi, David Young. I worked on this proclamation with the State's Attorney's Office, and the whole theme behind the having this proclamation, and it was really just so that we can respect the decisions of the individuals that may oppose any mandates coming through, especially the vaccine mandates. And so that was really the reason for putting this through. I know that there's a lot of, we have so many laws in place that does respect the individuals, but this is going back to the Constitution of the United States, the Illinois Constitution. And like I mentioned, I'd worked with the State's Attorney's Office just to create a proclamation that I thought would be somewhat, I'm going to call it watered down. And the theme of it is just basically to respect the individuals that are not going to get the vaccine and that have concerns over possible injuries from the vaccine. And that's kind of the whole theme, or that was what I was trying to attempt with this proclamation. Thank you.
Thank you, Mr. Young. Ms. Bates, or excuse me, one moment. One moment, Ms. Bates.
Shepro from the State's Attorney's Office. Shepro, State's Attorney's Office. I've been asked by the Civil Division to point out that, yes, they worked with Mr. Young in terms of drafting the resolution, but they would like to make it clear that they're not taking a position as to whether adopting it is advisable or not advisable, only that the proclamation in its form presented is not illegal, does not violate any current statutory laws. It is clearly a policy question for the board on which they express no opinion.
Thank you. Ms. Bates?
Thank you, Madam Chair. I have a question about the resolution. Does this resolution guarantee a woman's right to an abortion, which is her choice with her medical professional, which of course is also redundant to Illinois state law? Thank you. That's all.
Did you? This is a proclamation, not a resolution.
Okay, the proclamation. Does this also guarantee a woman's right to an abortion, which would also, of course, be redundant with Illinois state law?
Are you wanting an answer, or are you just making a statement?
It's a question.
Okay. Mr. Young, would you like to address her question?
It says, yes, yeah, abortion was not even part of this. Like I mentioned, the whole theme was based upon the vaccines and what laws are in place are in place. This is simply a statement from Kane County Board that says we respect the individuals that choose not to be vaccinated or get medications or even coerced to do so because they feel like they need to do it to keep their jobs. This is simply to support those individuals and their right not to get a thing, whether it be a device or a vaccine. But I don't know where you would have seen abortion in this, but this has nothing to do with abortion in the proclamation.
Madam Chair, may I speak?
Yes.
Well, what I hear in the proclamation is the protection of a person's right to go by their doctor's advice. And I believe abortion is included in that. So when we're talking about religious freedom, I believe that's part of it. Thanks, that's all.
Okay, thank you. Dr. Silva?
Thank you. I guess what I have to add is even for the purpose that you're outlining, Mr. Young, Commissioner Young, I don't think I think it's too broad. And I think I do think it's redundant. While I understand the spirit, and on a personal note, I can pretty much agree with everything on there on a personal note. But as a Kane County Commissioner, and having had experience a long time ago with the attempt to contain tuberculosis, that's what it brings to mind for me, is that some folks, when they are infected with the active disease, have a lot of things going on. They're very, sometimes they can be in situations where they're very troubled and have a lot of hardships. And so I don't know if we still have that program, directly observed therapy, but it is important to, for lack of a better word, quarantine and directly observe the taking of this medication, because it is a very serious illness. So I understand the spirit of what you're bringing forth, but even in that spirit, I don't think this is I don't think it's worded. And I think it opens up a whole lot of can of worms. So I cannot support it. Even though like I said, I don't mean to be redundant, but on a personal level, I understand the spirit. I understand what is being said, and I don't disagree with many of the statements, but we get to one where it has even nothing to do with the vaccine, and I think about other things. So I think it's too broad. And as Commissioner Juby pointed out, when I read it, I didn't do the research that you did. Thank you for doing that. But I thought, well, this already seems to be in place. So those are my thoughts.
Thank you, Dr. Silva. Yes, Mr. Sanchez.
Thank you, Madam Chair. I'm not opposed to any of these statements. I think just being a former chairman of this committee myself and understanding that we as county board members are also the Board of Health, not knowing some of the intent behind this, reading this, it almost implies that there is some concern that the health department would violate state or federal laws. And that has never been the case and never will be the case. And if that were to happen in to some degree, not only would we be all surprised and shocked, but we would take action as the Board of Health. So again, this just seems to imply that there is some concern that this would ever happen. And to me, that kind of delivers a message that we don't want to deliver to the health department and to the public, that, you know, this concern exists. I think it's just implied that we follow state and federal laws and that we respect people's freedom. We have never, ever proposed any type of vaccine mandate or any restriction on services for our employees. Even in the heat of COVID, that was never on the table to discuss as a possibility. So again, my feeling is that the implications of this, whether intentional or not, I know they're not intended that way. It reads as there is a concern, and I don't know that that's a message that I would want to support.
Thank you.
Madam Chair.
Who's talking? Mr.
Mr.
Williams? Yes,
Mr.
sir.
Williams. If I might, I thought the resolution was well written. It balances an individual's right to their own medical determinations with also balancing our commitment to follow federal and state law. So I don't see any reason why the body wouldn't support those statements. So I think we should pass it.
Okay. Any other questions?
Madam Chairman, this is Alan.
Yes, Miss Allen.
Just some old memories, and I don't have Dr. Silva's background, so I hope she'll correct me if I get any of this wrong. But we had a tuberculosis outbreak, I believe, in the Aurora area. And some of the people who were affected were people who were either homeless or marginally homeless. So what the county did was it paid to house those people in, I believe it was in a wing of a hotel, so that we were able to deliver nutritious food and the proper medications, and then also make sure, because nurses were delivering these products, that the nurses were able to see that the medications were taken. And this was not for a short period of time. This was for a matter of months in order to help those people beat TB and not spread it to anyone. So that was a pretty critical undertaking that we took. I think it was reasonably expensive. But once again, you start by protecting your community, drug court, mental health court, in this case, a TB outbreak, one person at a time, and get them restored so that you can protect both them and their community, all the rest of us. Thanks for letting me talk.
Thank you. So are we ready to take a vote on this? Okay, please call the roll.
Doobie,
Doobie, no.
Silva, Tarver,
Tarver's no.
Williams,
Williams, a yes.
Young,
Young, yes.
Sanchez,
Sanchez, no.
Stratton.
No. Motion has, our proclamation has failed. Okay. Now we will return to the regular agenda here. And so we will start with the Health Department updates. Mr. Isaacson, good morning.
Madam Chair, in light of Commissioner Williams needing to leave, did you want to hit those resolutions first before my presentation?
Mr. Williams, how much time do you have?
2 minutes.
Okay. All right, let's do it.
Yeah.
We're going to go to the resolutions under this. So we're going to do mix up everything this morning. So we'd like to start with the resolution of authorizing the salary increase for the executive director of the Health Department.
So moved.
Moves.
Should be second.
Okay, Sanchez and Juby. Any discussion? Okay. Clerk, please call the roll.
Doobie,
Doobie, aye.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Stratford,
Yes.
passes.
Okay, then we have, motion passes. Now we have a second resolution to authorize to enter in the grant agreements. I need a motion and a second.
Juby moves.
Sanchez seconds.
Okay, Juby and Sanchez, thank you. Any discussion? Okay. Do you want to tell us briefly what this is, Mr. Isaacson?
Yes, so this is our annual, we call kind of our blanket resolution that allows us to enter into grants that we get on a repeating basis. So this just allows us to expedite getting our contracts processed. So you can see, if you've been here, that this mostly relates to state grants that we have that are recurring. So typically we've done this in the summer. We're trying to align a little bit better with the county fiscal year so that we can have this in place.
Okay. Any discussion? Please call the roll.
Juby,
Juby, aye.
Silva,
Yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Stratford,
Strathman, yes.
passes.
And Williams signing off.
Okay, thank you for your time this morning.
Thank you.
Okay, now, Mr. Isaacson.
Excellent. And I kept my comments extra brief today because I figured we'd need to get to all the resolutions. So if people have time now, I can expand and really get into the details on everything.
Or lunch. That's all I'm
Yeah,
saying.
exactly. So you may have seen the new ad campaign from the Illinois Department of Public Health, "Tis the Sneezin'." I think it's kind of cute. They have a lot of videos that are running on TV and online right now. But it is a good reminder. As we talk about kind of the potential of a twindemic, we do have flu, we have RSV, and of course we have COVID. So we do encourage people. There are vaccines available for all of these diseases. So we encourage people to go out and protect themselves and protect those around them. I'll just show one slide with the Illinois or with data for Kane County for influenza-like illness. So if you can see the dark line, that's this year. So this is what's coming into our emergency departments with respiratory illness. It could be influenza-like illness. So we're still quite low and activity is still low in the area. But you can see we're starting to peak up. So this is looking at the last 5 years. There's several years where we've been much worse than this. But we are peaking up and it is getting to be the time of year where we're gathering with family and around more people. So just encourage people to take the usual protective steps. So of course, get your flu shot, get your updated COVID shot. We encourage people to get vaccinated for RSV. If you're sick, reconsider going and spending time with grandma for Thanksgiving or Christmas, because we don't want to be passing things on to others. Likewise, we don't want to be passing things on to anybody in the community. One thing I was going to point out, just a little educational opportunity here, the "Tis the Sneezin' here. You see this person sneezing into their hand. That's not what we want to do. So, sometimes what they're teaching the kids is, when you sneeze like Dracula and, hit it in the crook of your arm there. So, and then of course, washing your hands, stay home when you're sick, etc. And staying home also includes work, because nobody likes to have a coworker around them sneezing and coughing on them. And again, I think this ad campaign is pretty cute and does a nice job of showing that.
So that for the season of giving, it's not to share that.
Yeah, exactly.
Okay.
Just a reminder, we do have our free gun locks that we are making available to people. We'll share more about this in the future with this Project Safe Aurora, which is a specific grant we have that's focused on a coalition that we formed around gun violence, but just countywide. And again, my perspective on this is people who legally own guns. There's too many guns stolen. There's too many suicides that potentially could have been avoided if a gun had been secured. So we really encourage people to secure their guns. Ideally, they're keeping the ammunition separate from the gun as well. I know people have different ideas if it's a gun that they want to use for security, but they do have biometric safes that people can use that you can access very quickly. This committee and the whole board has talked about Ethan's Law. It's just too common for young people to accidentally die from a gunshot wound because they came across a gun. So just want to keep that in front of people.
Yes, Ms. Lewis, comment?
Before you move on, I'll be real quick. As part of Challenge to Change, we have been passing these out and we have gotten nothing but positive feedback. We did it at Bardwell Residence. We had, we probably did 60 or some that day. We did them at Downtown Alive. We're doing it again at the Cocoa Crawl. And people are really, really thankful to be able to get these. So thank you for the service. It's
Great.
excellent.
No, thank
Thank
you.
you.
And the team's doing an excellent job on that. And before I transition to talk about mental health and behavioral health, but of course, all of these things are interrelated. I'm really thrilled to introduce our newest member of the team. So I think we about have the dream team put together here. But many of you may know our new Assistant Director of Community Health, Ms. Michelle Meyer, who's joining us. And especially if you're in Southern Kane County, you know, she's had a long and fantastic career as the Executive Director at Mutual Ground. And I don't know how we got so lucky to be able to get her skills, but with Director Peterson, I think for the gun safety and the mental health and the substance use work that's going to be coming on, I'm really excited. So do you want to say hello and say a word or two about yourself? No, you want to be shy? That's
Yeah, thanks.
or maybe I don't know if there's other people want to say.
Baptism by fire.
Yeah,
Yeah.
no, I'm just happy to be here. I'm happy to, I've worked in the community for a really long time, live in Kane County and, live and play in Kane County. And so I want to make it as healthy as possible. So this position excited me because it brings me back to my health roots. And I'm just excited to be a part of this team under Kim and Mike and with the team here. So thank you for your warm welcome.
Welcome.
And I'm sure many of you have worked with Michelle and she's just going to be a tremendous addition to our group. So
And we do think you have a dream team.
we do. We really do have a great team we've put together here. So it's really exciting what's coming in 2024. So one preview, we're hoping to be on the agenda for the ARPA committee next week and just want to revisit, and we'll dig into this more, and the behavioral health work will be under Director Peterson. But just to kind of plant a seed for conversations we're having, and this is some of our work product that we're really focused on. When we work with mental health and substance use providers in the community, there's three main areas that we've identified that are opportunities. One is really around how do we develop and sustain a workforce so that our families don't have to wait to get services, and that when they get services, they're getting the best services they possibly can. Number two, what are those items in the community that currently are not funded, where the county can step in and provide supports that may make a huge difference in somebody's life. So as we've talked about a lot here, we're not looking to replicate things, even as we grow our footprint in behavioral health to meet the need. And again, mental health is identified as the #1 priority in our last community health assessment. But how can we support organizations? So how can we support like a Mutual Ground? How can we support a Family Service Association or an AID? How can we work with the police departments to make sure that we use some of our expertise for data to look at things from different angles? How can we partner with the courts to make sure that our individuals in the community who may be facing a lot of challenges? And my approach to this is always, if you like people, this is great because this improves quality of life. It keeps people out of jail. It keeps people off the streets. It makes life better for people. It makes life easier for families. Even if you don't really care about people and you just care about finances, which not to say you have to be one extreme or the other, this saves our community money. So keeping people out of the emergency department saves a tremendous amount of money, not just for the county, but for every one of us in paying our insurance premiums. Keeping people out of jail is a much more efficient way to do things. So to me, this is just a win-win. And then finally, how do we communicate these things? We still have a lot of stigma We still have a lot of opportunity where we can communicate to different people to get them into treatment sooner. How can we identify people sooner? So over the next couple of months, this is really gonna be launching, and there's a lot we're gonna be doing around behavioral health. So stay tuned, but we're really excited about what's to come with this. And then I just wanted to touch on the community health assessment and strategic planning. So two separate things, but my request to you as board members is going to be similar. So we've shared all of this information with you. We put pre-made emails and ways that you can pass this out to people in your community. We already have a very robust sample size that we've already collected information, but we want more, and we want to make sure that everybody's represented. So anything you can do to get these surveys out in your community, that again, the more, the better. We're about to start some focus groups over the coming weeks. So we'll be working with specific populations, whether it's seniors, whether it's talking to young people, talking to people about mental health and substance use, so that we can get more of that qualitative information. So we want to hear that. And then, for better or worse, I've been holding back on sending my survey to you about the strategic planning because I was waiting for the budget to be finalized. That's taken a little longer than I thought. So
Taking a little longer period.
Yes. So I have just a 2-question survey that I'm going to send you, but I'm probably going to wait until maybe the first week in December. But just as a preview, really, I want to know for you, and it's just open-ended. What do you see as the biggest health issues in your community? Because we want to use that. That's going to inform our community health assessment, but it's also going to inform the health department strategic plan in terms of what should we be focusing on, where should we be trying to find more resources, whether it's other grants that are out there available to us, et cetera. And then also, what do you think in general? So one is, what are the health issues going on? And the second one is just more you as an individual. What do you think we should focus on? And I'm happy to sit down and meet with any of you, give you a tour of our building, do any of that fun stuff. But we definitely want your input. I'd like it if it, we can talk offline. I'd like to make it not anonymous, just so I know who I need to go and bug if you haven't responded. But what we certainly want anonymous input too, but hopefully we get feedback from all 24 members so that we're moving forward. And this health department is something that you can be proud of, is representing what you think are the needs for your community. Any questions about that? And again, I've talked about this in the previous months. We're hoping to complete our strategic plan in January so we can go ahead and launch it. And then the community health assessment, you'll be invited to a session where we prioritize once we get all of our primary data collected here.
Great.
So lots of exciting things. And with that, like I said, I tried to keep it short so that we could talk about all the other stuff, but.
Any comments or questions? Okay, thank you. Okay, any old business to bring before the committee this morning? Okay, and I'd like to ask for the reports to be placed on file.
Sanchez asked for unanimous consent.
Thank you, Mr. Sanchez. Okay, I don't believe we need an executive session. And anything under new business? This is new business / comments by the chair. Dr. Isaacson, I keep on, someday, I guess I'm premonition, right?
Yes.
Mr. Isaacson and I are working on an idea to, in this committee, present some of the wonderful programs that are available through the Public Health Department. So that as a committee, we will know exactly who the target audience is, or, target group, and have some of the people who benefit, or so we can all learn, so we can promote the different programs that are in the Public Health Department. So.
And quick sneak peek, we will be highlighting some of the work that we've been doing with parents in the community. So Kate McCormick, who's leading our Children's Mental Health Initiative, and Director Peterson, they'll be here in December with many of our parents. And it's just so exciting to see this. I think this is a huge success as we get input from people, and then I'd empower them is not the right word because they already kind of have the power, but help provide resources to them so that they can really participate in policymaking in our community. So just a sneak peek, I think the December meeting is going to be pretty exciting.
Yeah, that's great. Okay. Okay, if that's all, can I have a motion and a second to adjourn?
We have no further public comment, correct?
There is no further public comment, correct?
Tarver moves that we adjourn.
Okay, Sanchez moves, Tarver seconds. Can I have a voice vote?